Hello, everybody. Welcome to my course on Sociology of Health. This is our 10th lecture, and this is the last lecture of the course for the second week. The theme of the second week is theoretical perspective to understand health, illness, and medicine. And the topic of today's lecture is World Health Organization, holistic approach, and cross cultural perspective. Now, let me very briefly help you to understand the context of the cross cultural perspective. In the previous lectures, we talked about the biomedical perspective, which is the dominating perspective on medicine and medical care. Then we talked about two macro perspectives, the functional perspective and the Marxist perspective. The functional perspective helps us to understand and locate the health institutions like the hospitals, medical care centers, and the role of the health professionals within those institutions and how do they interact with the patients within the system or subsystem approach. So that was basically an effort to understand the healthcare centers in the larger society. Then we had the Marxist critique of the biomedical approach as well as the functionalist approach, which stated that disease is primarily a result of the capitalist mode of production. And then they tried to look at the healthcare center and the health institutions and the medical care institutions and the hospitals and the larger sector which was emerging from the perspective of the class conflict and the affordability of the people who wanted to avail of that kind of services and several other things. Then we saw the symbolic interactionism and the micro approach, which basically argued that the health behavior takes place at the micro level among the individuals or in the interpersonal interaction. Maybe that is in the form of the doctor-patient relationship, or maybe in the form of the patient and paramedical staff relationship, or for that matter, the relationship or behavior which is existing among any two or more persons, but that was a micro perspective. Then we talked about the post-structural perspective, and within that we primarily talked about the Foucauldian perspective, which talked about the power perspective operating through these health institutions or medical care centers. Foucault tried to talk about several things. He referred to archaeology and genealogy, but the point that is coming from Foucauldian perspective in very briefly, if we can summarize that, was saying that some kind of power is basically coming into the picture because of the knowledge of the medical professionals, and the medical professionals sometimes help in enhancing the surveillance of the patients and the people because of the kind of medical encounter that the people may have to face. So that was altogether a new kind of understanding about that. However, simultaneously there were several other things happening. World Health Organization got established in 1948 and gave a very important multidimensional definition of the health. Then in 1978, basically, World Health Organization in collaboration with UNICEF gave the call for primary health care and the target of health for all, and that is known as basically the Alma Ata Declaration. And the realization was that health should reach to each and every individual globally, irrespective of any kind of differences, whether that is income related difference or racial difference or any other kind of differences. right? So that call for health for all has initiated new kind of understanding, initiatives, collaborations among all countries, and now there was a new type of challenge emerging. Now, what was that new challenge? The challenge was basically related to the differences which were existing in the cultures or the subcultures of the various communities world over. Now, biomedicine is very important, but when this biomedicine or medicine is used within the medical care framework or the healthcare framework, then the care component is also getting attached with this. Now, the care is basically a human phenomenon. So, biomedicine or medicine alone cannot serve the purpose of providing health. It needs the support from human care. And when we talk about the engagement of the human, then culture, their beliefs, their norms, their practices do come into the picture. And so simultaneously, there was an increasing realization of understanding the culture or the subculture of the people from the perspective of health and medicine. And in this larger perspective, there was emergence of the cross-cultural perspective simultaneously. Two other things also happened. WHO talked about multidimensionality of health, and then it also defined primary health care. Now, these efforts were basically trying to widen the scope of health and healthcare. So, the anthropologists have been trying to understand medicine and healthcare among different ethnic groups or tribal communities. Now, they were having a rich knowledge about the ethnic medicine, folk medicine, and different types of practices. So, simultaneously, there was some kind of development taking place or happening within the perspectives to understand the health and related phenomenon, and at the same time, there was growth taking place within the medical care and healthcare institutions. So, this lecture is primarily an effort to sum up the kind of developments which were there in the 20th century, or better to say the second half of the 20th century. And that is why I have included three similar but different topics: World Health Organization's concept of primary health care, then the concept of holistic approach to health, and then the cross-cultural perspectives. Now, we are already aware of the dimensions identified by World Health Organization in the definition of health, which are basically physical dimension, mental dimension, and social dimension. Then there was also a call to add the spiritual dimension, and gradually there is also a focus to include the emotional dimension, something that you are already familiar and we have already discussed. Now, we come to the concept of primary health care. According to World Health Organization, all people everywhere have the right to achieve the highest attainable level of health. This is the fundamental premise of primary health care. The concept of primary health care gives a pragmatic model to attain health for all. Now, just few minutes before we stated that the Alma Ata Declaration basically gave the goal of or the target of health for all. Now, when the world community is having the target of health for all, then it should have enough resources for that. And if we look at health only from the perspective of biomedicine, then certainly there were limitations or restrictions or constraints. So, there was an increasing understanding that healthcare is not just the use of the medicine or the biomedicine, rather it is much more than that. And so the concept of primary health care developed. We will talk about the various components of the primary health care as basically mentioned by World Health Organization, and it is available in the website of the World Health Organization. You can go and see these things at length there. Primary health care is a whole of society approach to effectively organize and strengthen national health system to bring services for health and well-being closer to communities. So, in few words, we can say that this is the whole of society approach. That means all agencies of the societies are actually responsible and they all need to work as one unit for achieving this primary health care. Now, there are different components related to this. First is integrated health services. That means there are different type of determinants and factors that we have been talking about, and till now we have understood that how different perspectives focus on different aspects. Psychosocial determinants were also considered very important, and there was growth of basically preventive and promotive kind of health behavior also. We will talk about these things later on also. So there was a need of having an integrated health service to meet people's health need throughout their lives. The next is addressing the broader determinants of health through multi-sectoral policy and action. Now, broader determinants of health means there are nutrition related determinants, then there are sanitation related determinants, right? Because simultaneously there is widening of the scope of the public health. So all these determinants cannot be fixed by one single agency, right? So here there is a need of a multi-sectoral policy and action, and this is what is basically intended here. Then empowering individuals, families and communities to take charge of their own health. So all the facilities basically cannot provide good health on their own unless individual and communities basically absorb those things and empower themselves to make use of those things, right? We'll talk about this point after a few slides also. Then primary health care enables health system to support a person's health needs, from health promotion to disease prevention, treatment, rehabilitation, palliative care and more. This strategy also ensures that health care is delivered in a way that is centered on people's need and respect their preferences. Now these few words are very important. What people's need and respect their preferences, because people's need may vary. Now let us try to look at the things more pragmatically. If we are talking about the world population, then there are differences. There are racial differences. There are income related differences. There are cultural, religious differences. And so very often, because of those differences, people's preferences may change. Their food behavior may change. Their lifestyle may change. So medicine cannot think of creating a kind of homogeneity or homogenization. It cannot impose, right? And that is why there is mention of the word respect their preferences, right? So simultaneously, the diversity perspective is coming into picture. And here I would like to tell that postmodernism, which developed after post-structuralism, did talk about giving importance to culture, as postmodernism is negating the idea of meta-narratives or the grand theories and focusing on cultural diversity, right? So this diversity in terms of culture is getting reflected or need to get reflected in the health behavior, or especially the healthcare providers' behavior. Then on the basis of the discussion, we can say that the responsibility for health is actually divided at three different levels. One at the level of the individual, and second at the level of the community, and third at the level of the state. And simultaneously, we can also talk about the engagement of the international agencies like World Health Organization or United Nations. But because those the suggestions of the global communities do come into picture through the nation states, so state is the third very important agency. Now some sort of responsibility is lying at every level, and the target of health for all could not be achieved without the proper engagement of all the three agencies. So this is a new realization. Then we come to a very important approach which developed simultaneously, which is known as holistic approach to health. The basic concept of holistic health is that a human being should be an integrated whole. Now, as we have discussed the things before when we were talking about biomedical perspective, that time it was stated that biomedicine is focusing on the disease and not the person. That means if a person is suffering from 2, 3, 4 different types of disease, then the medical care approach will focus on those specific disease as such and not on the person as such. So that idea is negated in this new emerging concept or approach to health, which is known as the holistic approach, which says that human being should be an integrated whole and should be treated as an integrated whole. Health professionals keep refining their definition of health to describe a state of total well-being. The constant interaction between all elements of the body makes it impossible to separate mental health from physical health, social well-being from spiritual well-being, or any one of these elements from the others, as each contributes to the status of the other. Now, going a little further from that disease thing, if we talk about the different dimensions of health, then we have seen that there is a mental health, there is a social health, there is a spiritual health, there are different dimensions of health. But actually, all these dimensions are interrelated. If one dimension is not working well, then the rest of the dimensions will not perform well. That means there is a need to look at all these dimensions as a whole, and that is why this holistic approach to health was basically developing. According to this holistic concept, a healthy person is one who successfully experiences growth and development in all of these elements more or less at the same time. Then there are specific prescriptions related to the requirements of a holistic approach to health. Now, few decades before, Fraser talked about some of the important requirements, basically 5 requirements. I have mentioned those in this slide. Very briefly, I will talk about it. The most important idea is the promotion of health by teaching physiological principles of healthy living and providing good diet. So if you talk about health, then what would be most important thing at the level of the individual? That would be basically the understanding of the physiological principles of healthy living and then providing good diet, because without that a person cannot be in a position to appropriately take care of his own body or health. The second stage is to prevent illness. Now, if the first stage is done well, then the person should take care of preventing himself from illness, chiefly by the application of medical knowledge in relation to a specific disease and by inoculation. Inoculation in present context is basically understood as vaccination kind of thing. So some kind of prevention would be very much required. Then the third stage or requirement would be detect early departure from normal health. Now, first and second step is being followed, and then if there is some kind of contact of some infection or realization of some ailment, then there should be an early detection of that, because an early detection will be very helpful in going for proper treatment or care and remedy. And if possible, then some kind of inoculation so that the prevention can take place. Then the fourth stage constitutes aftercare of sickness or injury. Now, if the person is becoming sick, then yes, of course, he or she may need the kind of medicines or treatment. But after those medicines, there would be the requirement of the care. So, the aftercare of sickness or injury, in which remedies are sought for social factors. So, if a particular problem is caused because of engagement or involvement in a particular kind of activity, then the person should restrict himself or herself from getting indulged in that kind of activity, because there can be repetition of that very problem. So that can be seen at a larger level. A situation which has created a problem should be avoided in the social life, so that that problem should not reoccur that very way. And the last stage deals with the management of incurable sickness, and it seeks for a worthwhile amelioration of it. Now, there are certain diseases or sickness which are not having appropriate treatment available, right? So, if there are certain incurable sickness, then those should be handled appropriately. So, Fraser talked about these 5 stages for the preservation of health, and if all these 5 are followed appropriately, then this can be considered as holistic approach to health. This is one model of holistic approach. There are several other models of holistic approach, but I thought of talking about one only so that we get an idea. Then there is basically a very popular concept which is known as holistic medicine. This is a medical paradigm that views patients in the totality of their environment and as mental, emotional, social, and spiritual as well as physical beings. From a social movement's perspective, holistic medicine is a professional movement of the mid to late 20th century. This movement is said to respond to the excesses of biomedicine. So again, holistic medicine goes beyond the biomedicine. And then there are certain specific requirements which are mentioned over here, that how one can practice the principles of holistic medicine. Time will not allow me to explain, but these are actually self-explanatory. Then we come to the cross-cultural perspective. We have already highlighted the context in which the cross-cultural perspective emerged. The contributors are basically sociologists and anthropologists and ethnographers, those who studied the different cultures and the subcultures which were existing in different communities and where there was a specific worldview related to health, illness, and medicine. Cross-cultural perspective on health refers to the diverse viewpoints, beliefs, values, and practices related to health and wellness that exist across different cultures and societies. Now, let me add one more thing here. We are not only talking about the different communities, we are talking about different groups of people also. Very often, persons living with disability, they are having certain impairment, certain constraints, so they may not interact with the medical professionals the way the rest of the population is interacting. Certain people have linguistic barriers. They may not interact the way the rest of the population is interacting. Certain groups are basically very vulnerable or marginalized. Then in all these situations, a different kind of subculture is coming into existence. So when we talk about cross-cultural, we are taking into consideration all these types of subcultures and cultures. This concept recognizes that health is not solely a biological or medical phenomenon, but is profoundly influenced by cultural context, societal norms, traditions, and individual beliefs. So now these are self-explanatory. Studying cross-cultural perspective on health within the sociological framework offers critical insights into understanding health disparity, access to care, and the impact of cultural competence in healthcare provision. Right? So we have included topics like health disparity, health inequality, health marginalization. All these things take place within the state's governance system, within a particular nation state. But this cross-cultural perspective is trying to understand what is happening in those situations and trying to address those by making an advocacy for the use of cross-cultural perspective. Sociologists endeavor to unravel the complexities underlying these disparities, advocating for culturally sensitive approaches in healthcare to ensure inclusivity and equity in healthcare systems. Then there are different people who have made their contribution in this particular domain. Some of these are anthropologists, some of these are ethnographers. For example, Kleinman and Locke made specific contributions. Now, Kleinman talked about the explanatory models, where it was highlighted that the importance of understanding cultural variations in illness perception and treatment seeking behavior is important. Now, illness perceptions are also very important. Recently, when we basically faced COVID, then more than COVID, the perception of COVID was actually threatening us. Of course, the problems were very disturbing, but the perception of that was equally more disturbing. Or for that matter, when the world witnessed AIDS, then there was a perception related to that. So prior to that, tuberculosis, there is, or malaria, all these diseases have one reality and then one perception. That perception sometimes is very disturbing. So Kleinman made his contribution in this particular context. Then Margaret Lock, known for her research on medical anthropology, Locke's work delves into the cultural construction of illness experiences, particularly in the context of Japan's aging population. Now, we all know that when life expectancy is increasing, then the proportion of the aged is increasing. Now, with that, basically, with the increasing number of elderly population, a new kind of subculture or culture is actually emerging. And Japan is basically a testimony of that. And many other developed countries are witnessing that kind of phenomenon. So, what are the specific requirements in that context? Those things have been highlighted. Then Farmer's research in medical anthropology and global health emphasizes the significance of addressing social determinants of health and the impact of cultural factors on healthcare delivery, particularly in marginalized community. Just like that, Frank, known for his writings on illness narratives and the socio-cultural aspect of health. Now, what is illness narrative? We talked about it earlier. When some person is ill, then he is communicating or she is communicating, and through that communication a narrative is actually building up. Now, that narrative is very important. So this illness narrative may vary depending upon the presence or absence of certain agencies over there. So it would be the responsibility of the medical professionals to create the right kind of narrative. And there is a new growth of narrative medicine also. Maybe we can talk about that during some lecture. Then Nancy Krieger's work in social epidemiology and public health emphasizes the role of social and cultural factors in health disparities. Now, what is epidemiology? Basically, epidemiology is the scientific study of the spread of a disease. So if we have epidemic or pandemic, then the spread is very vast. So a systematic and scientific study of that spread in a larger area is conducted, and that is known as epidemiology. Epidemiology is basically very important, social epidemiology and public health, and in sociology of health, this is a very important method. So we can come to the concluding part of this lecture. The cross-cultural perspective emphasizes the need for a culturally sensitive approach in designing health promotion programs, disease prevention initiative, and interventions that resonate with diverse cultural contexts. Because when we have health promotion program, then again different sections of the society have different types of preferences or needs or the requirements. For example, if you talk about the dietary requirement, then certainly different segments of the population may have different types of nutritional deficit. So the program for providing nutrition should take care of the nutritional needs of different segments of the population, or for that matter in any other case also. Then this approach ensures that public health strategies are tailored to address the specific needs, beliefs, and practices of different communities, thereby enhancing their effectiveness. Then communities are again very important. We have different types of differences, linguistic communities, religious communities, ethnic communities, right? So there are basically differences. And if we take care of these things, then it will be very helpful in designing new research methodologies which will be culturally sensitive. Sometimes we may also talk about the specific epistemology to address the health related needs of the population. So, globally, there is increasing involvement of the sociologist and anthropologist in devising the health programs, addressing the health research, and especially the epidemiological aspects related to that. Even in India, we have ICMR, that is Indian Council of Medical Research, and it engages the anthropologist and sociologist in the various expert committee. And then earlier we talked about sociology in medicine, and we stated that sociology in medicine are the sociologists who are working in the healthcare centers, hospitals, medical centers, and they are supporting the medical professionals in basically providing support to the patients or healthcare seekers. So this way, the cross-cultural perspective can play a very important role in attaining the goal of health for all. And this cross-cultural perspective developed within the academic background, which were preceded by several other theoretical perspective that we discussed in the beginning of the lecture. So with this, I come to an end of this lecture. Now I have added one think about this problem and one activity question. So the think about problem is this: can we consider the World Health Organization's definition of health as a holistic approach towards health? Think about it. We have already discussed these things. And the activity question is health a cultural construct? We have already discussed this thing in this lecture and some of the previous lectures. So try to explain this briefly. So with this, we come to an end of the course for the second week. And in the next lecture, we will start our course for the third week. So till then, take care. See you there.